Hello everyone, I'm Dr. Beatrice Hippolyte and this is your world. Hello everyone, today we have the privilege to have with us Nurse Becca.
Yes.
How are you doing today?
I'm good. Thank you for having me.
Oh, it's a pleasure. The pleasure is all mine, darling.
Oh, thank you.
How was the commute?
The commute not bad. We're on Long Island, so this is nice. This is a nice little drive. It wasn't very
Okay,
long,
and
yeah.
the good thing is not raining today, so the
It's not.
sun
It's
is
sunny,
out.
yeah, and it's actually a little warmer too.
Yeah, compared to a few days,
Yes,
I must say yes.
Yes.
It
I didn't have to
is.
pull up my scarf today, so that was good.
Okay, that's wonderful. So tell us a little bit about you before we even get into the subject that we're gonna talk today.
Sure, no problem. So I'm Nurse Becca. I have been a nurse for over 10 years. I started out as an LPN, and while I was working night shift, I went back to school. I got my BSN as an RN, and I work in a hospital now. I started out in the hospital in heart failure, which was pretty tough, but it made me, who I am. I always believe that your experiences shape you to who you are. And now I'm currently in labor and delivery. I have a podcast myself, the nurse aspect, but that's what I'm doing right now.
I watched so many episodes of that podcast.
Thank you.
It's very impressive. Congratulations.
Thank you so much.
And I'm so proud of you.
Thank you.
One thing that I must tell everybody, I remember when I was starting with this podcast, Nurse Becca was on it. Everything that she knows, she will tell me. I was really grateful to that. So
I love
thank
sharing
you so
information.
much.
I don't like to hold people back. I always feel like what's for you will always be for you. You don't ever have to fight with someone or not share information in the hopes that they're going to steal what you have. Whatever's supposed to be meant for you is going to be meant for you. So I always like to share information.
Amen to that, sister.
No problem.
At the end, I hope that you will have an opportunity to tell people exactly how to watch your podcast
Of course,
and
I will
how to
share.
subscribe.
Not a problem. Thank you.
And I know today's how you want to talk about disparity in mental health during pregnancy and postpartum. Why this topic is important
This topic
to you?
is so important. So my experience as a labor and delivery nurse, I see so many patients on a daily basis. I see patients in triage, which is like our emergency room. I have patients in labor and delivery. There's patients initial recovery period. And there's so many patients that come in that have either a history of anxiety or undiagnosed history of anxiety, which can increase their chances of having postpartum depression. Especially in the undiagnosed, it's not addressed at all. And so a lot of times people have thoughts about harming their baby, harming themselves. Am I a good mom? And it's first-time moms, people who've had 10 kids, it can happen at any time. What I find is that a lot of minorities for sure don't have the access to, either see a therapist, be on medications. And so there's a big disparity there. But I also think that a lot of it is not just minorities. It could be Caucasian. Anybody can fall victim to it. But it's just something that is not addressed in healthcare. People look down on it socially, culturally, maybe not even accepted for you to even talk about your issues. For example, the Asian community are very stoic. They don't really even show pain. It's almost looked frowned upon for them to even show pain. So if you can't even show pain, how can you even express that you having thoughts that maybe I'm not a good mom, nobody cares about me?
But do you believe that can be part of the culture too?
And for sure, it's cultural. But in nursing school, they actually tell you that Asian culture are very stoic, so you have to do a little bit more to assess their pain. They're not going to right out say I'm in pain. Even if I'm offering, we have an epidural, you don't have to, be in pain. They actually would rather take the pain because culturally that's what is accepted for them. Whereas someone of the Latin community,
if you go and show or lay yourself as somebody who is in pain, that can make you look weak.
right? Exactly. So those communities do have, I feel like, a higher incidence of having a disparity in having anxiety, postpartum depression, and just not even being able to get the help. I always make a point to talk to my patients and let them know about postpartum depression. It's very real, that it's okay to reach out to someone. I think that maybe even 10, 15 years ago was not as accepted, whereas now it's more widely accepted for you to seek therapy, for you to be on medication. A lot of times I tell my patients, if you can't discuss it with your family member because maybe it's not culturally accepted, that there's a wide world of community, that's available. TikTok, social media. There's a lot of things. There's Facebook group for new moms, where people can go to and feel comfortable in sharing their experiences where maybe they're not comfortable with sharing their experiences
And one
at
thing with
home.
postpartum depression, during the first few weeks after giving birth, you may not experience any symptoms, but that can come further down,
Yes,
even
that's true.
after 6 months, even after 3 months. So it's very important to really consider.
It is. I will say that I tell my patients all the time that, when in pregnancy, everybody's so concerned about the belly. Everybody's like giving you their thoughts, want to touch your belly and everything. So the focus is on you, right? Then baby comes and now people are coming over and they almost like push you out the way to see the baby. So everybody's more so concerned about the baby now, which is understandable, but internally that does do something also to a woman that maybe, let's say you don't have, that you're not confident in who you are as a person, or maybe you have a pushy mother-in-law who wants to take over everything. They're doing everything in the house, changing the way that that you have things set up. You'd feel less important.
Or it can
all
be
of those
your
things
own
can lead
mother
in.
too.
It could be your own
knowing
mother.
that you know what, she knows it all because
Yes.
she gave birth to 5,
Exactly.
7 kids. So she thinks that she's a master
Exactly.
into raising or taking care of babies. So now putting you like behind,
Yes, yeah.
and take over of everything. So
Yeah.
I've seen few cases like that,
Yeah.
and I really understand
Yeah.
where you're coming from.
I will also say too that even with the older school providers, don't really accept or even treat mental health. A lot of times, you might be on a medication, or maybe you have a therapist that did put you on some sort of medication, or you are seeking treatment, and now you're going back to your OB provider and you're maybe doing your 6-week checkup or something like that, and your OB will tell you, if you're on this medication, I'm not going to see you. A lot of old school providers are like that. So there's a disparity even there, because you could be seeking the help and now you're going back to your doctor for a regular checkup, and because you're on this particular medication, they won't see you. So now it kind of puts you at a further disadvantage, if you will, or exacerbate the issue that of postpartum depression.
The medication that you say, so if you are on that medication, it's mental health related medication?
Mental health related medication. And I think that a lot of times with certain OB providers, like I said, old school, so people who've been working 40, 50 years, that could probably deliver a baby with their eyes closed, may not recognize or accept the mental health aspect of postpartum depression, and may not want to seek to treat you. So it's almost as if I'm going to continue to go to my doctor that I've been going to since I was 16.
Do you think that it's because they don't understand, or they
I
don't
think so.
believe in the seriousness of the issue?
Yeah, I think so. And it could be a combination of, and again, it's, if you think about growing up things in their time, it's not accepted, right? Like you can have a mom that comes in and they're saying like, oh, you're being hysterical. You can have real pain, but you're being hysterical. And that's how it was back in the day. Whereas nowadays, we're going to take a look and further assess to see what's going on. This is not hysteria. This could be it could be masking itself as something else, or you just need a further diagnosis. But a long time ago, it wasn't like that. So when you have people that for sure probably had some sort of postpartum depression, anxiety, misdiagnosed mental concern that is related, that maybe came up after pregnancy, or maybe just undiagnosed and it came out during pregnancy or afterwards, they don't recognize it. And so it wasn't recognized then, it's still kind of the same way. And a lot of times people are hard to change. Change is hard to accept in general, and even comes down to even your provider. So that can also present itself as an issue.
One thing that I've experienced, so I've seen, many women were eager to have children, and they wanted to have children. They waited for so long to have children, and many of them have even walked through some medical process to get pregnant. But after giving birth, the amount of change that little baby bring into their lives kind of shift everything.
Yeah.
So some women will just by looking at the body, not being the same.
Yes.
That can be a big trigger.
Yeah.
For them to experience, some mental health issues. Some people, it may be like, the baby crying for whatever reason.
Yes.
All night. For some, it may be like, hey, now, so it's like, I don't have a life anymore. Because before being pregnant, there was no preparation. After you give birth to a child, you basically won't have a life for your own self.
Yes, it's over.
And everything that you're gonna do in life, gonna have to be around that child.
Yes.
And many of them were not prepped.
Yeah.
For that.
I think that a lot of times they may have not been prepped, or maybe they heard it and they know this, but actually experiencing it is totally different. A lot of times, like I think that people do have, undiagnosed anxiety. Everybody has some form of anxiety in general.
That's life.
That's life. But it's also, how are you dealing with that too? Are you dealing with it appropriately? Some people go to the gym and take out the anxiety in the gym, right? It's a healthy way. You release endorphins, and so it helps you in that sense, in terms of how you're treating your anxiety.
Yeah. And you have to know when there is something strange going on in your body.
Right.
Because your body is your body. You know your body.
Right.
If I woke up this morning or for the entire week, I've been feeling a certain way, I must know that, you know what, I'm not fully myself. Something is not right.
Right.
So it's like whatever that is bothering me, or that may bring a lot of stress into my life, or anxiety. So it's like you said, I may choose to go to the gym. Some people may choose to listen to gospel music. Some people, or any type of music that can help them release, that anxiety or that stress, or do something. But you have to know your body to understand when something is not right. Right.
To me, I think there's two parts to what you said. I think one, yes, like I was saying, in terms of how you deal with your anxiety, if you deal with it appropriately or inappropriately. For example, if you have someone that is like they decide to eat and end up overeating, and that causes an issue in terms of, now I can't lose weight, I have now maybe body dysmorphia, look what this baby did to me, and that can further exacerbate you. They say studies have shown that, women with a higher body mass index, of BMI, are more prone to experiencing postpartum depression. The other thing is from what you were saying, is that it is actually being able to recognize that I have an issue. If you're not in tune with yourself, or maybe you don't have the opportunity to express to your family and feeling open to, that may further put you into a higher incidence of seeing postpartum depression. For example, Haitian culture is not accepted maybe for you to say whatever you want, to an older adult, right? The older adult is the one that knows best. So if you're experiencing something, they may just say, stand up, you got to be stronger than that, and that's it. That's the end of the conversation. There's no conversation after that, right?
Or you just had a baby. That's what mothers have to
and
go
that's
through.
it. Yeah.
And that's it.
Maybe that's it, right? So that's how that goes. But now I'm maybe now internally dealing with something that is not addressed, and now I could be, now of course I still have the lack of sleep, maybe I don't have the help, maybe if you're a single mom, or maybe it's just you and your partner and that's it, and they say it takes a village, right? And the baby could be colicky, breastfeeding, all these things take up time, and now you're not properly taking care of yourself, which is expected to a certain degree, but now I also don't have an outlet. And so those things are all going to increase the chances of you experiencing postpartum depression. I think part of the issue is definitely recognizing that there's something wrong. This is not normal. There's a fine line, but this is not normal, and being able to communicate with someone that's going to accept that, you know what, maybe you do need help. And it could just start by talking to someone that you trust, which a lot of times you recommend a therapist, right? It could be your pastor, whoever, but part of it is being able to have that open communication. And if you need something like medication, to recognize that it's okay for you to have the medication, but not be judged by, I do need the medication.
Yeah, so it's like, basically you're telling me, so it's important for my feeling to be acknowledged.
Correct, yes.
And whenever that I feel that I need professional help, and I should not be afraid or ashamed to seek for that help, because at this moment it's needed.
Right, totally correct, yes. Yeah, but postpartum depression, I think that it is something that affects every community, and it's not just, I don't think that it is just African American. I don't think it's just Asian. I think there's a higher incidence, because I also think that part of the problem is your care. There is a higher incidence of African American people not receiving the appropriate care during pregnancy. How can we even be able to recognize that there may be an issue here,
While you're mentioning that, so I was looking at the racial ethnic discrimination, or disparity among, Black women. More likely, they are more prone to experience postpartum depression due to racism.
Yes, that's true.
And socioeconomic factors. And lack of access to health care.
Correct.
Compared to white women.
That's true, yeah. In the hospital, I've seen so many times where we can have two of the same patients, right? One Black, one white, okay? And they have literally the same exact symptoms, but for example, you could say that the white person that's coming in that is maybe 1 centimeter dilated, that is having severe pain, will maybe get an epidural first, or offered an epidural first, whereas someone that is, the same exam, that's Black, all we did is change the color of their skin, and it's not that bad. You can keep going, maybe, And so even just that little, but why did you offer it to this person and not to me? A lot of times too is that you might have a Black patient that's coming into a predominantly white hospital, and so you likely are getting a predominantly white nurse who may not be racist, but has racial tendencies in that sense, again, in even
which
just
is
treating,
unfortunate.
It's unfortunate, right?
Because patients should, if I were to be a nurse, a doctor, or any healthcare provider, my main priority should have been my patient care.
Right. And sometimes I think that a lot of providers who, again, may not identify or see themselves as racist, and maybe they don't even really mean it in that sense, but will have those things. But again, you would have to be Black or a minority to even understand that what you're doing is not correct. You don't understand how what you're doing makes me feel this way. And if a minority understands oppression versus the majority is not going to understand the oppression.
It is unfortunate, and though I don't work in a hospital setting, but I think I've experienced like something slightly similar to what you just mentioned. I remember one time at work, so it was like, they higher above always conduct their meeting in the hallway. The minute that you got there, you see the lineup, not to walk through. But that day, it was me and a white lady who were walking. We were probably 3 to 4 feet apart. And I saw the cool lineup, and the white person just walked through.
And nobody
said
anything.
And nobody, I thought that she got to get away because she was not stopped. I was right behind her. And it was a black person among that group who just said, "Ma'am, stop." And I'm like, we're gonna have a big issue today because I'm gonna keep on working. I'm like, what's going on?
Yeah.
What did just happen?
Yeah.
It was at that moment, one of them said, "I watched you let that white person walk through, and none of you stopped that person.
Yeah.
And now when the black sister is about, and you want, ma'am, keep on going." I said, I was not gonna stop. So it's to tell you how sometimes we are wired to allow certain things to happen,
Yeah.
with this group and prevent it from happening to another group.
Right.
And I can see how that same behavior or mentality is going on even when it's come to provide people with best quality of care.
Yes.
It is unfortunate, but it's a reality of life.
Yeah, it's so true, so true. So I think part of the in terms of healthcare, just this is a little, I guess, off topic, but in terms of healthcare, I think it's so important to have representation. It's so funny how like now with everything happening with DEI, and in today's world, how that can be impacted, but it does make a difference in seeing someone of your own kind take care of you, right? And not to say that there can be a little racism even in that you could have a black provider that is racist towards you, but I do think that it's I would say maybe less likely, so I totally never have a problem to show up for my own patients, and just being that I don't treat anybody any different, whether you could be black, blue, purple, doesn't matter how you are. I'm still gonna talk to you the same way, but
Because
it's
as
not
a
everybody.
nurse, your
My
main
priority is my patient. I don't care what you look
It's
like.
to take care. It doesn't matter,
Right.
So you don't go by race, sexual orientation, religion, or financial.
Right.
When I have a client comes to me, the first thing is like, hey, I see all my clients as human beings.
Right.
That's what you are.
Yeah.
You are a human being, and I'm gonna treat you based on your need.
Right.
So if your need, it's like, hey, you have a wound that need to be taken care of. So how the heck I have to look at whether that you white, blue, brown, or yellow? How relevant it is
Right.
to what you're dealing with at
Right.
this moment.
It's so true, but some people can't see past it skin deep. Some people can't see past that, unfortunately. And it ties into so many other things, like, and just receiving healthcare, receiving the appropriate healthcare, pain-wise, mental health, especially in the Black community. There's so many undiagnosed mental conditions, and then you're adding pregnancy on top of it, so that it just keeps on getting further and further back, where someone who is born in the right skin color will have different treatment, likely just because maybe they had access to the healthcare that African American people don't have access to. Maybe they're treated differently because they're taking more seriously in terms of whatever they're experiencing, and even having someone being able to listen and communicate with you in terms of understanding that I am having an issue and I do need to seek, I need help, as opposed to just blowing them off and saying, it's nothing, you'll get over it.
Yeah. So it's a big issue.
It is.
It is a big issue, and unfortunately, it seems not to be addressed, appropriately.
Yes.
Because oftentimes, so what people see is like, oh, that woman is pregnant, so it's like it's just a joy for the moment. This person gonna bring a brand new child into the world. Everybody seems to be happy, but at the end of the day, that mother may be dying inside.
Yes. So true. Again, it just comes down to how open are you to be able to discuss what you're going through? How is it going to be received? The thing is, now we listen and we don't judge. Like, that's a big saying nowadays, right? We listen and we don't judge. But are you listening and are you judging? Because those are the two things I feel like people have a problem with. I think that even myself, before I was a nurse, or maybe even my early stages, I would, someone would say something and I'm like, how could you say that? But you really don't even know what the person is going through, what the context of what they're going through, how are they living, you could have a partner that's beating you every day and you can't say anything, something like that. Are you living in a condition where you're in a stable home? All of those things can impact your mental health. As I'm sure you would, that, the environment that you're in impacts your mental health.
And according to research, you even have mothers who kill their babies
Yes.
after giving birth.
Yes.
Because they were going through that process.
Yeah.
Babies were crying and the mother could not take it. So it was too much. They didn't know how to deal with that.
Right.
And before even know it, through the window,
Yeah.
they just threw that baby out.
Yeah, and it's so unfortunate because every hospital is or most hospitals are safe havens. You can literally just go to the hospital and just drop off your baby, no questions asked, or a fire station, something like that. But I think a lot of times,
sometimes you don't even know what's going on in the brain.
That relates to the mental health. So this is part of postpartum depression, which is why it can exacerbate itself into something that's so much more greater. Whereas if the issue was addressed, it could have been prevented. A life could have been saved. Yeah.